it is a co-ed
Yep.
company.
Yep.
So a lot of them will see this as well. So don't just talk directly to women. We
Right.
have
Everybody.
Yeah. But it's easy to go crazy with women
Yeah.
because we're the hormonal messes, right?
No, actually, no.
Really?
No. You'd be surprised.
So men have those hormone issues?
Low testosterone.
Really?
Like most men have extremely low testosterone. They don't realize even how much better they would feel if we start working on raising their testosterone
Well,
levels.
Interesting. Well, welcome.
Women think they're nuts, but no. Men have a lot of
We
issues
get
too.
blamed for being nuts,
That's right.
but men can be nuts too. Oh
That's
my
right.
goodness. Oh, I am so glad you are joining us this morning. This is going to be an amazing show. Welcome to Healthy You. We are live this morning down at Peoria Life. We are live with you every Wednesday morning at 8:30. And it's just about education, information, motivation. I want to provide you all the resources that you need to live a healthy lifestyle because let's just face it, there's so much. And there's so much misinformation out there as well. And we are doing the best that we can to make sure we provide the right information to help you live a healthy lifestyle and give you that foundation and the fundamentals and principles that can make it a little bit easier. It's never going to be super easy. It's a disciplined life. We know that. It's hard work.
Yep.
So it's never going to be easy, but anything to help make it easier.
Correct. That's right.
And so I am thrilled to have you here with me, Dr. Carrie. In fact, this is Dr. Carrie Musselman.
Hello.
From Preferred Care Medical Center. That's your business.
That is correct.
And you are going to help us understand this whole holistic field that we are hearing so much about.
Okay.
And I am so interested in this. I think I know enough to make me dangerous.
Right. That's right. That's right.
And so that's why I'm like, I have to have you here to help me understand a little bit more. So
Okay.
I think the biggest question is we all know the word. Everybody understands holistic. You think you do. You hear it a lot, but we don't. I guess the truth is we don't understand what it actually means.
Right.
So what does holistic mean?
Okay, holistic means a couple different things. One thing that I always try to impress upon patients, people in general, is just holistic means your body as a whole and trying to do things more naturally. So, you always have these different routes. You have traditional medicine. You've got the way opposite end of the spectrum where people don't do any sort of medication surgeries and they only do supplementation, vitamins. But ultimately, it's actually taking all of the different specialties and bringing it together to try to look at you as a person and figure out what would benefit you completely. And holistic, again, means try to just do things a little more conservatively, a little more naturally. You always have drugs and surgery to go to. I mean, that's always going to be there.
It's necessary.
Absolutely. And so that is one thing. I am a chiropractic doctor, and so do I believe that, chiropractic is a great specialty and it helps patients a lot? Absolutely. Do I believe it's the only answer, the only way? Absolutely not. So you can't say that, an orthopedic surgeon is the only way to go, or, a general practitioner is the only way to go, or a chiropractor is the only way to go. Really what you should do to be really smart about it is to, again, get as much information as you possibly can about your body, whether that's through exams, labs, saliva testing for hormones, different things like that, and then come together as a bunch of specialists together to figure out, hey, these are different options for this person. These are different things that could benefit them. Your body is different than my body, is different than your body. So the entire thing is trying to figure out for you what would be some options for you to try, and then you go from there. You figure out, did this work for you? Did this work for you? Did this work for you? Just because there's certain supplements, certain medications, certain things that might work for you, that doesn't mean that you and I have the same symptoms that it's going to work for me.
Right. But we know that there is healing in food.
Absolutely.
Right?
Absolutely.
There's healing in nutrition
Absolutely.
and exercise. And I have friends, I know people who are curing themselves of, extreme issues, medical issues like cancer. And so that is compiled under the holistic health, correct?
Absolutely.
And now that's an extreme measure, but I was talking to you before the show started about premenopausal. Yeah, that's me, right? I'm going to be 45 in October, so I'm in that premenopause, the night sweats.
Yeah.
Oh my gosh. much.
Yeah.
Crazy.
Yep.
So you would look at me as a whole and say, okay, am I low in certain supplements or certain nutrition, certain
Absolutely.
vitamins, things like
Yeah.
that?
Yep. And the other thing too is that nutrition, you hit on a huge thing. Nutrition is something that people really don't understand. And so, to go in for a yearly physical and have the doc say, hey, lose 15 pounds, it's not that easy, especially if everything that you've been doing has made you gain 50, 60, 70, 100 pounds. You're not going to be able to just say, oh, okay, I'm going to lose 15 pounds. It's going to be easy if you really don't understand it. So a lot of what we do is, again, besides looking at you as a whole, putting specialists together and trying to give you options of what you can do for your health, we also try to educate you and help you and guide you and be coaches so that we can really actually help you to be healthy. And a big part of that is nutrition, losing weight, getting to an ideal body weight.
Right.
And that's going to help your immune system and fight off a whole bunch of disease further down the
A whole
road.
bunch of stuff. There's
Yes.
a couple of things. So many people think, and type 2 diabetes is one of these. I witness this every day in my career in coaching. Most people think, oh, I can't eat bread because I'm type 2 diabetic. Well, you're type 2 diabetic because you're overweight and you don't exercise. But if you lose the weight, the diabetes somehow goes away.
Right.
And you even can still eat bread sometimes.
Right.
So it's really, that's the part that I think that missing link that people don't understand. Once you reach a healthy weight, so many things start to fix itself. But the problem is getting from here to here.
That's correct.
And feeling like it. The next thing you have is energy.
Yep.
Because if you're out of whack, holistically speaking, then you're going to not feel good.
Right.
Which
Yep.
makes it difficult to want to exercise.
Very much so. Or if you're fighting disease, and when I say disease, I mean it is type 2 diabetes, high cholesterol, high blood pressure, things like that, heart disease, lung issues, congestive heart failure, fighting those things, arthritis, knee pain, hip pain, back pain. You don't want to exercise. You don't want to do any of that stuff. So I have a lot of patients that always come to me and say, well, how do you expect me to exercise? How do you expect me to lose weight when I hurt so bad all the time? There's nothing I can do. So again, what a lot of people don't even realize is 15 pounds is kind of the ideal. If you focus on losing 15 pounds, not 100, that 15 pounds is going to help you substantially decrease your blood pressure, help with cholesterol.
Yes.
And then obviously doing different things, doing some physical therapy, doing massage therapy, taking your supplements, making sure you're getting the right vitamins and minerals, those macronutrients, getting adjustments, doing those types of things. Right. You're going to be able to get out and you're going to be able to exercise. Again, most of it is actually just what you put in your mouth. So if you actually eat a lot better, you're going to drop a lot of weight without the exercise part.
Yes, 85%.
Although exercise is extremely important, just for cardio health and everything else, but most of it is what you're putting in your mouth.
My favorite line is this: you can't out-exercise a bad diet, but you can't lose weight without exercise. You need to burn those extra calories. You can lose a little bit of weight without exercise, but at some point your metabolism will drop to a low enough level where you need to move extra in order to continue to burn enough calories to lose weight. So it depends, but you really cannot out-exercise a bad diet. It's 85% of your health is what you eat.
It is.
Okay, so you have a really cool story about how you decided to become a doctor. And I think everybody loves stories, and we want it's you've walked the walk, you've been down the road, you've been through this holistic approach, and you've experienced it, which is why you're so passionate about it, obviously.
Yep.
So how did you get passionate about this whole integrative medicine and holistic?
Okay. So I'll tell you first, just briefly, what happened to me as far as becoming a chiropractic doctor, and then how I decided to expand into working with specialists and the whole holistic health. So I did not grow up in a chiropractic-friendly family. My mom worked for a surgeon. We did not go to chiropractors. Kind of thought it was hooey, all that fun stuff. And then, but from a young age, I think I was in second grade when I started getting migraine headaches as a child. So I would vomit, just not feel good. My teachers knew to excuse me when I got up to run to the bathroom because my head hurt all the time. So we went to all different types of doctors, pediatricians, neurologists, and They couldn't understand why I had migraine headaches. They wanted to put me on all this medication, then experimental medication, eventually telling my parents that I probably had a mental issue. There was something wrong with me, that I was making it up and causing myself problems. And it just went on for years. And I ended up becoming an athlete in high school, and I hurt my back in a basketball game. And we had a new chiropractor in town who was advertising himself, for free exams, come meet the doctor. And so my mom said, well, it's free. We'll just go see what this guy does. So we went in, and he started feeling my body, feeling my spine. And he said, do you get headaches a lot? And I said, I absolutely do. I can get at least 3 migraines a week.
Oh my gosh.
And he adjusted me. And after he started adjusting my neck, I didn't get migraines anymore. It was like that.
Oh my goodness.
So for me,
got chills.
Yeah, for me, that, there are few miracles, or, what people can claim as a miracle in life. For me, as a teenager, that was a miracle in my life, that I had struggled with migraines for years. And after I got adjustments, I did not get migraines anymore. So off the medications, off everything. And I mean, that's one of the things that really pushed me absolutely to, hey, there's something about this. And even though my family still was kind of, not real excited about my chosen career, I had to do it. And so,
even though your mom saw you get better.
Yeah, it was still, for whatever reason, ingrained in their head
that is funny you say that, because isn't it true? We get these things ingrained in our mind
for no reason, really. There was no bad experience.
What you just heard over and over. And so then you have the hardest time of changing, even when you witness it right before your very eyes.
Yep.
You witness it.
Yep.
And then you're still going, well, I'm just not sure.
Yeah, yeah. To this day, at family functions, I still have aunts and uncles that are like, well, you're not touching me, so. But you know what? I love what I do, and there's been a lot of patients that have been helped, and I wouldn't have picked anything different. So a lot of education, a lot of schooling, but it was all worth it. So one of the frustrations I have had, though, as a chiropractor is in certain states, chiropractors, you have a different scope of practice. You're allowed to do different things. So in many states, chiropractors are allowed to do labs, blood work, and that's all part of our training in school.
Right.
In the state of Illinois, it's a little bit more limited, so we're not allowed to do some of those things. So what I ended up doing was I was banging my head against the wall, because I would help so many patients with headaches, neck pain, back pain, but they would still have hormonal problems.
Right.
They still have problems with their digestion, reflux, all sorts of stuff. And so I would refer them out. And unfortunately, with how many doctors and specialists there are, there's this big breakdown, lack of communication. You try to get reports from this doctor, and you just don't get it. You try to follow up, and doctors are busy, and there's not a lot of time. Hospitals are busy. Things get lost in the shuffle. But I would refer these patients out, and I'd never get the information back. And then sometimes I would never even see the patient again. So you're trying to follow up. You're trying to help this patient as best you can, but you're not getting that information. And so I just thought, well, gosh, either I need to go back to school, and I'll get my MD also, so then I'll be an MD-DC and I can do everything. But at this stage in my life, I have 4 children, so I thought, and one on the way now.
You probably can't tell because she looks like a superstar.
Yeah. So number 5 is on the way.
Number 5, it's like, until you turned around when I met you, I'm like, oh my gosh, she's pregnant, and you look amazing, though.
Thank you.
Just to say, but
Thank
anyway.
You. Yeah. So I just thought, okay, well, right now is not ideal for me to go back to school and try to take care of everybody. So then I kind of thought, well, the next best thing would be to, why not hire? We all could be under the same roof, and we all could work together to really try to benefit the patient as best we can. And so that's when I started thinking about medical integration. So we take the chiropractic aspect. We also do rehabilitation. You can hire physical therapists. We have massage therapists. Then we get the medical doctors, nurse practitioners, physician assistants. We get the medical side of things. And what we do is, when a patient comes in, regardless of what your problem is, whether it's back pain and you just want chiropractic care, or you have a sore throat, you would go through the medical side. You'd get a full comprehensive exam.
Right.
And then from that point, we would decide if you need further testing, if you need labs, if you need saliva tests, if you need x-rays. Once we get that information, all of the providers in the office actually sit down and talk about you and figure out, okay, this person came in presenting with this. We also found this, this, and this. And so these are different options as far as what we can do to try to help you. And then we present that to you, and you obviously pick. And if there's one thing that's really bothering you right now, say it's your thyroid, thyroid function isn't good, you're, feeling like you have menopausal issues, fatigue, going out of your mind, all these things, and that's what you want to focus on, then we would pick that, we would focus on that. Maybe you want to do it all. Maybe you're a person that really wants to just get your whole body worked on. So then we start incorporating.
And sometimes your insurance covers that. And
well, absolutely.
And some people have to be careful depending on what covered, but you might want it all, especially if your insurance is
yes.
good and
right.
You get
if your deductibles met and and it's that right time of year for you to do all that, you can focus on your body. We can do adjustments. We can start. So the adjustment part of it is correcting misalignments. Then we work on the physical therapy aspect of it, working on the exercises to strengthen around that good foundation.
So you have a physical therapist on staff.
So currently we have the nurse practitioners and we have the PAs, and they are the oversight on the rehab. So we have rehab specialists that come in. We have different staff members that come and go at different times. Sure. So right now we currently do not have a physical therapist actually on staff.
No, okay, but it's something that you have available under. And then that way, so when a person comes in, I see what you're saying, you have the whole holistic thing going from the inside out. You don't just medicate. No. You start working on the problem. If you do need medication, it's
we have
available.
That option. That's right. We offer the nutritional counseling. So we help with the weight loss. We do the nutritional counseling. We give you options. We tell you different supplements to use. We offer many different brands. But again, some people really respond well to this brand or this brand. So we do offer different brands. But we do the supplementation, vitamins. We also offer compounds. So instead of just going strictly with the medication, we can do compounding creams, things like that.
Oh, cool.
But again, it's up to the patient. So some patients come in and they strictly want, hey, this works for me. I know this works for me in the past. I'd really like to just do this drug. Okay, that's fine. You know what? I'm tired of doing that. I've done it for 15 years and I don't want to do it anymore. And I want to try to turn a new leaf, turn a new page, and I want something different. So then we try to go a little bit more of maybe the compounds, the supplementation, and see how well they can do with that. But again, what you had touched on before, just even initially some of that weight loss, it's amazing how many diabetics we've had get completely 100% off their medications.
Oh, I see it all the time.
Yeah.
I mean, you're preaching to the choir. We see it all the time. Like, I mean, you could walk in Curves at any given time and talk to women who are off their type 2 even
blood
shots.
Pressure meds like that.
Blood pressure, but insulin shots and things like that. It is absolutely amazing. Okay, and even let's talk cholesterol for a second. This is a true story, and I want to get your input on it. My mom had high cholesterol.
Okay.
They wanted to put her on medication. My mom is one of those women that she loves supplements and she does not take medication. In fact, unless you make her, she doesn't even go to a doctor. Okay. She's old-fashioned kind of, I would say.
Like male.
I know. So this is my mom. She's in her 70s and she's like, I'm not taking nothing. So they wanted to put her on medication, and she's like, I'm not taking medication. What can I do naturally? And they told her to fish oil, omegas, just take that. That would help lower her cholesterol. That's what the doctor told her. And she was like, okay. So she goes out and she starts taking this fish oil supplement, which I believe in omegas. We know about that. But the point is, she started taking it, and she got checked a couple of years ago, and she cut out some fats in her diet. And started taking this fish oil. Her cholesterol, boom. She didn't even lose weight. She stayed the same weight. She's not really overweight.
Okay.
So what's that story like? You take these supplements and all of a sudden now your cholesterol's better. How does that fall in line? And what is it okay to just be like, okay, I'm going to start taking fish oil? I mean.
Yeah. So fish oil is not dangerous, okay? Everybody should take fish oil. There's been a lot of studies that actually have shown that people that take fish oil have a lot less chance of Alzheimer's and Parkinson's down the road. Again, fish oil is good fats, good for your brain. Your brain's mostly fat and water in your body. So that's one thing. Everyone should take fish oil. All fish oil is not created equal. So that is something that, you'd have to talk to a provider about to really figure out, which brands are better or not.
Quality.
Yes.
That's important.
It really is, so, but I would say that's an excellent story. That's a great example. That's not going to be the case for everybody. That's not always the issue as far as cholesterol goes. So just because you're going to start taking the fish oil doesn't mean your cholesterol is going to go down. There are sometimes genetic factors and different things like that. But that's just a perfect, great example. You can use that. You can tell people, again, to give them hope and to let them know, hey, it could be something as easy as fish oil.
It could be. And that's what we want to share the word about with the holistic. So what other good supplements for, like, let's just say hormones? Somebody might be watching and they're like me. What would you take me through if I come in and I'm like, Dr. Carrie, help me. I'm having night sweats. I'm irritable. My husband's ready to kick me out.
Yeah. So I don't think you even understand how broad of a question that actually is. So again, if you were to come in, excuse me, and you just really wanted to try to get yourself balanced and figure out where you're
naturally.
Yes. We would do a saliva test on you. We would do labs on you. We want to see, your estrogen levels, progesterone levels. We'd want to see all of those things. And then we could give better recommendations on the different supplements that would benefit you. There are some basic ones. Again, it all depends on the brand too. I can't tell you to go to Walmart and pick up a woman regulating, hormonal supplement.
It has
I
to be it needs to be a formulated good supplement.
It really
you may not even absorb it.
That's exactly right. You could be taking them and just urinating them out.
Right.
So, but again, there's always that little placebo effect, like you're taking something that's going to help you. So you are probably going to get a little bit of a side bonus on that. But
well, and that's the other thing I tell the ladies, not to sidebar, but when you're trying to live a healthy lifestyle, especially if you're trying to lose weight, there is that placebo effect when it comes to taking supplements, meaning you feel good about yourself.
Yeah.
You're doing something that's going to help yourself. And so it naturally makes you feel good about yourself.
Doesn't necessarily mean it was a great supplement, just means that you already have consciously made that decision. I want to help myself, and you're trying to do something. So again, you might feel something different just because you're even doing that. You've made that decision. I've decided, right? So, but in your case, it really would be more specific to what we found on you. There's different things, something generic. If you have night sweats, there's a herbal supplement called wild yam. So wild yam is something that typically you would recommend to a woman that is complaining of night sweats.
Wild yam.
Wild yam.
Okay.
Sounds crazy, but herbal supplements typically have weird names. So wild yam is what it's called. And again, that might help 60% of the population. You might be in the 40% that it does nothing for, but that 60%, it really does help. So we would just have to take a look at you and figure out, hey, these are the different things that would probably benefit you, that would really help you. And again, if you have 15 different things going on, usually you don't want to tackle all 15. You might want to pick the top 3, and we'll go with that. And then once that is resolved, then we would move. And a lot of times what you'll find is if you have 15 different things wrong with you, after the top 3 are taken care of, you probably don't have 15 anymore. You might drop down to about 7. Instead of just 12. And then you could take the top 3 of those 7 and then work on those. So you want to focus a little bit more on, which ones are bothering you the most.
The most important things.
Absolutely.
If you have several issues going on, you got to tap into the most important thing and start working your way down. But once you get one thing, those underlying issues, and that's what I love about holistic health. You tackle it from the inside out. You're not putting a Band-Aid over it.
Absolutely not.
And sometimes I think if we just go and we get the synthetic, and that's what you would call medication that's not natural, that's made in a lab, created in a lab, right? And sometimes we need those.
Yep.
So we are not knocking them, but the fact of the matter is it is synthetic, which means your body doesn't necessarily recognize it, which is why it has a million side effects. Because
or what happens is your body is using that, so then really what your body is supposed to be doing starts shutting down. So you actually lose function because something fake is taking over that function, and then it doesn't allow your body to actually do what it is naturally really supposed to be doing.
And our bodies, I have learned this over my 20-year career, our bodies will naturally, they're designed to heal.
Right.
Like our bodies want to heal.
Absolutely.
It's designed to do that.
Absolutely.
And would you say that's kind of the whole integrative, holistic way is to help your body to do what it's designed
Absolutely.
to do?
Absolutely. Yep. That is
I love it.
True, correct statement right there.
Well,
try to do less interference and allow the body to heal itself. And that's one of the components of chiropractic as a profession, even, is to try to back off a little bit and let the body try to work and heal itself. Get rid of some of that interference, that external interference, and allow the body to do what it's supposed to do.
What it's supposed to do.
But again, there are absolute times when you have to have medications and surgery. You have to. So
yeah, I mean, if you break your arm,
yeah,
you need
needs to be set. Yeah, that's right.
You gotta get that. You gotta get that taken care of. You know, so there are things that we know there are reasons to have medical doctors, and we love them and are grateful for them when they need them. But I think we were talking about this
that we
before
can work
the show.
together.
I love, and
yes.
that's awesome too, Dr. Carrie, that you have all this under one roof.
Yes.
So you're kind of like that one-stop shop with everything under one roof, which I love that concept.
Yep. We just don't want anyone to fall through the cracks. We don't want to miss out on anything. We don't want someone to say, well, why didn't you follow up with me? You know, this was a year ago that this happened. You sent me out. You know, by having it all under the same roof, we do actually have 2 meetings a day. We have a morning shift, an afternoon shift. We all sit down and we talk about our patients. So
collaborate
absolutely.
and decide what's best. I think
and do we still have to refer them out for specific things? Absolutely. But whatever we can take care of under our roof and communicate with each other, again, to give the best care we can to our patients, that's our priority.
Absolutely. So everything under one roof. Now, we were talking a little bit. We only got a few minutes left here. I can't believe how fast a half hour goes. But you touched on thyroid.
Yeah.
And that is huge.
It is. It's a big issue.
And so are you treating a lot of patients holistically with thyroid disease?
Yes.
And are you having luck with that?
Yes, we are. And treatment of the thyroid has changed substantially over the years. And so that would be something even maybe on another show, I would have maybe one of my nurse practitioners come in, because they can go over all of the new updated research on this is how this should be treated and this is what's getting the best results. And I think word of mouth gets out. If you come in and you're feeling, you know, dry, brittle hair, you know, dark circles under your eyes, fatigue, just a little bit of depression, all of those things, a lot of that can be, you know, attributed to the thyroid issue. So again, you run labs, you kind of check that out, but labs are not always the definitive, hey, this is...
Sometimes if it's not broken, it's hard to see that it might be just running
again,
inefficiently.
for you personally, you might just fall, you know, low on the spectrum, but not, you know, have to take Synthroid the rest of your life or something like that.
Right.
But for you, it's still low in how you feel and your symptoms that are presenting. So we would still want to treat that. And again, then you would feel completely different. Your symptoms would change, and you would just, again, your life would be changed, because every other time you had your labs, you fell within normal limits, but that doesn't mean that that's a normal limit for you.
Right. It's about how you can start to see how you feel.
Yeah.
Like you'll know, and you'll realize I must have had an issue. It could have been a little sluggish.
Just a quick example of that, you know, what is a normal blood pressure? Most people say normal blood pressure is
120 over 80.
Right? 120 over 80. You know, I've always had a very low blood pressure. I mean, I could be 80 over 60.
Yep.
I could be, you know, 70 over 45, whatever. I just have a very low blood pressure. Been an athlete my entire life. But again, I go to doctors and they might say to me, gosh, don't you pass out? Don't you faint? Haven't you done this? Haven't you done that? Maybe we need to do something, you know, and I've never had any issues. I have energy. Like I said, college athlete. This is going to be my 5th child. I work hard. You know, I've never had any issues. So why, just because I don't fall in that normal 120 over 80, do I need medication now because my blood pressure is not right?
Well, it's funny because now they're actually saying that 120 over 80 might be a little high. So come to find out, we're the normal ones, Carrie.
they have to set guidelines again,
they do,
so people can get on Google and see what's wrong with them or whatever. But you know, they have to set guidelines, and so that's how how they do that with thyroid testing with different sorts of things. But that doesn't necessarily mean just because that is what is the norm, that is the norm for you. So
13 seconds. I know somebody's going, how do I get in touch with you?
Okay.
So we know you're at Preferred Care Medical Center in Peoria. That's over in Junction City. We love Junction City.
Yep. We have 4 locations. We're in Roanoke, we're in El Paso, we're in Eureka, and then we have the office here in Peoria.
Get in touch with Dr. Carrie. She's full of information. Thanks for joining us this
thank
morning.
you.
Enjoy
Thanks.
the rest of your Wednesday.
Yep.
Awesome.
PeoriaLife.com